This is part one of my midterm practical for pathophysiology for athletic trainers. In this scenario, an athlete has collapsed on the ground in the athletic training facility. So my first move would be to do a size up of the scene. I just want to make sure that there is no other athletes or individuals between me and the collapsed athlete. I would look for any objects, any potential hazards. If we were outside, I would make note of the ground condition, if it was raining and the grass was wet, or if there was any holes in the field. I just want to make sure that I'm not going to trip or get hurt on my way to the athlete because that could delay care, and I always want to protect myself first before giving care to the athlete. So once I made sure that the scene was safe and I could approach the athlete, I would next do an overall view of the injury. I would check for their body position, and I would look for any clues that could have led to the injury. When I first arrive at the athlete, I would make sure that they are alert. I'm seeing that they are not, they're not moving, their eyes are open, and they're not responding to me. So then I would try a verbal response with them. I would say things like, "Hey, are you okay? What happened? Can you respond for me?" They're still not responding, so then I would move into a pain response. And they're still not responding to me, so then I would determine that they are unresponsive. So I would go straight into my primary survey. I would do my ABCs. I would open up their airways first by tilting their head back and making sure that their airways are open and they're not choking on anything. I would check for their breathing by looking, listening, and feeling their chest rise and fall. And I see that they're still breathing, and next I would do their circulation. So I would feel for their carotid artery and feel for a pulse for about 5 seconds. And then I would check for any shock. I would check for severe bleeding, and then I would check for any spinal injuries. This would take about 15 seconds, and now that I see that they are still breathing and they still have a pulse, they don't need any CPR, so I could check and do more vital signs. I could do their blood pressure with their blood pressure cuff and my stethoscope. I'm going to put my stethoscope on their brachial artery. And pump it up, looking at the gauge. And then listening for their heart sounds while watching the gauge fall. Once I got their blood pressure, I would record it. I could check their skin. I would want to look for any signs of discoloration. If they are pale or clammy from shock, I would do a capillary refill test by pinching the nub of their finger until it was blanched and then releasing to see how long it would take for the color return. I could pinch the dorsal side of their hand and see how long it would take for their skin to fall back. I would just check the overall condition, color, and temperature of their skin and their nail beds or on their face. And then I could go back and measure the respiratory rates. I would count how many respiratory rates they would have in a minute by counting for 15 seconds and then multiplying by 4. And then I could also do this for their pulse rate. I would count their pulse rate for 15 seconds and then multiply by 4. And then I would record all this information while the EMS were arriving, and when they got here, I could tell them exactly what their vital signs were and exactly what happened so they could provide the best care.